Good afternoon, everyone. Welcome and thank you for joining. I'm Cassandra Williamson-Hopp, the conference editor of Benefits Canada, and your host for today's webinar. New specialty drugs deliver patient benefits, but also impact private health benefits plans. Benefits Canada's Drug Innovations webinars provide insight into new drug introductions. Today's webinar, sponsored by Sanofi Genzyme, will discuss how biologic agents have offered physicians an expanded armamentarium of treatments to help manage patients' conditions. You'll hear from a physician who will share her perspective on the treatments available and why one drug can be effective in treating many related diseases. You'll also hear from a patient who suffers from multiple respiratory conditions about his journey and the impact these conditions have had on his quality of life. Just a few housekeeping notes before we get started. This is an example of an attendee interface. You should see something similar on your own computer desktop in the upper right-hand corner. Please use the orange arrow to open and close your control panel and the audio tab to select your preferred audio, either mic and speakers to use your computer audio or telephone to dial in using the information provided. If you have any questions for today's presenters, please type them into the questions pane of the control panel. You can send in your inquiries at any time, and we'll be collecting these and addressing them during the Q&A sessions. To begin, let me introduce you to today's presenters and explain the slightly different format of today's webinar. We'll start off with a presentation by Dr. Susan Wasserman, Professor of Medicine and Division Director of Clinical Immunology and Allergy at McMaster University. This presentation will then be followed by a brief live audience Q&A session. Then we'll hear from patient advocate Jess Prera, and followed by another round of Q&A from our live audience. So without further ado, I'll hand the floor over to you, Dr. Wasserman.
Thank you very much, and thanks very much for the opportunity to present to you today. Anyway, the topic that I'm going to be discussing is nasal polyps and associated asthma. Next slide, please. These are my disclosures, and I have done work with a number of companies in respiratory and allergy medicine. Next slide, please. So the agenda for today is going to be about chronic rhinosinusitis with nasal polyps and associated asthma. I'm going to give a definition of both of these conditions. I'm going to talk about how these conditions affect patients, how are they treated, why can one drug treat many conditions, and why should Dupixent be included in drug formularies. Next slide, please. Approximately 20% of all patients with chronic rhinosinusitis have nasal polyps. And by chronic rhinosinusitis, I mean chronic inflammation or infection. And the number of 20% can vary depending on what you read. Some literature cites it as high as 56%. Nasal polyps, which you see on the right-hand side of your screen, are growths in the nose that develop due to persistent inflammation, and they protrude into both nasal passages, causing obstruction. Next slide, please. They are a chronic inflammatory disease of the nose and the sinuses. What you see on the left-hand side of your screen is a healthy nose with two patent open nostrils. On the right-hand side, you see that the nasal polyp is practically obstructing the whole nostril in your view. Next slide. Nasal polyps are present worldwide, and this is just a representation of the prevalence of nasal polyps in certain countries. In Canada, it's estimated at about 1.5%. In the USA and Western Europe, upper limit of normal of 4%, and China around 1% as well. Next slide. And nasal polyps can coexist with other diseases, and we refer to these other diseases as comorbidities. So approximately 50% of patients with nasal polyps have severe asthma. Asthma causes cough, wheeze, and breathlessness. And 30 to 45% of patients with severe asthma have nasal polyps. 17% of patients with nasal polyps have atopic dermatitis. Atopic dermatitis is the medical term for severe eczema. And 13% of patients with atopic dermatitis have nasal polyps. So as you see here, there's certainly a coexistence of these three different conditions together, namely nasal polyps, asthma, and atopic dermatitis or eczema. Next slide, please. And why does this happen? Because nasal polyps and associated asthma share a common pathophysiology called type 2 inflammation. They have a common basis of inflammation. Next slide, please. In the center of your screen, what you see at the bottom is a cell called the eosinophil. The eosinophil is the main inflammatory cell which is present in type 2 inflammation. And the growth factors that bring this inflammatory cell into the various tissues are called IL-4, IL-13, and IL-5. Eosinophils can deposit in many different organs in the body. When they do so, they cause damage by releasing certain products. In the upper airway, they can cause allergic runny nose called allergic rhinitis, chronic rhinosinusitis with nasal polyps, and they can also cause a fairly severe aspirin allergy referred to as AERD, aspirin exacerbated respiratory disease, which can send people into a severe asthma attack. In the lower airway, they cause eosinophilic asthma. So what gets the ball rolling with this type 2 inflammation? When certain bacteria or fungi or allergy affects the lining in a certain way, IL-4, IL-13 cause eosinophils to infiltrate, causing nasal polyps to grow in the nose. And similarly in the lungs, where some of the main triggers getting this going are respiratory viruses as well as allergy. Next slide, please. Chronic rhinosinusitis is characterized by clinical symptoms and objective findings, and these need to be present in order to make a diagnosis. You need 2 or more of the following symptoms to be present for at least 12 weeks. Nasal blockage or congestion, nasal discharge, pain and facial pressure, or reduction in loss of sense of smell. And there also have to be objective findings. These can be seen either through a nasal endoscope, which is a little tube that goes into the nose, where you can see either nasal polyps and or purulent discharge, which looks like pus, and or nasal obstruction. The other way to objectify findings is through a CAT scan, which is a type of radiographic procedure that shows opacification of the sinuses, which means that the sinuses are inflamed. Next slide, please. This slide gives you just a bit of a taste of what the patient journey is like in diagnosing and treating nasal polyps, not only for the patients, but for the clinicians. And the journey can be a long one. Patients will initially present to their doctor, generally their primary care physician, complaining of certain symptoms such as congestion or loss of sense of smell. The primary care physician may or may not see nasal polyps at the time. Many will not even examine the nose on initial examination. The first line of treatment is usually intranasal steroids. The family doctor will make a decision at some point based on symptom severity as to whether or not to refer this patient to either an allergist or an ENT, which stands for ear, nose, and throat specialist. If symptoms are proceeding or especially severe, they'll go on from intranasal corticosteroids to possibly oral corticosteroids, which is often the second line of treatment. If this is ineffective or many different courses of corticosteroids become necessary, that patient will be sent for their first surgery. And this is a cycle that often repeats. Patients will go from a background treatment of nasal steroids to oral steroids to a surgery. Recurrence is certainly not uncommon, which I'll show you shortly. And these patients again go back to more oral steroids and more surgery as time progresses. So this kind of cycle can go on for many years where there's treatment which ends up causing no permanent benefit for these patients. Next slide, please. Nasal polyps and asthma certainly affect the quality of life and have impact on the patients in their own right, but they also share many aspects of quality of life. Asthma by itself causes frequent exacerbations, which can lead to long-term complications. By exacerbation, we mean flares or attacks of their symptoms. This can lead to airway remodeling, also known as airway scarring, which causes a decline in lung function. These patients also suffer the adverse effects, especially of oral steroids. which are often used to treat this condition if it is not well controlled on usual inhalers. Nasal polyps by themselves lead to nasal obstruction, nasal discharge, reduction in the sense of smell, which is certainly very upsetting for many patients. And again, because of the use of oral steroids, which are often seen in these patients, they suffer adverse effects of these medications as well. The shared quality of life effects on these patients are anxiety and depression seen with both conditions, sadness and embarrassment, sleep disturbance, which can be profound, and fatigue, decreased productivity of work because of feeling like this, and of course, work absenteeism and presenteeism, where they just can't perform as well when there. Next slide, please. In spite of the adverse effects of oral steroids, which I've mentioned, oral steroid use remains high in Canada. And this is just data that pertains to asthmatics. 30% had used an oral steroid to manage asthma symptoms in the past year. On average, patients took oral steroids for at least 3 days, 3 times in the past year. This doesn't sound like much, but remember, 5 days of prednisone leads to an increased fracture risk of about a year's duration. And among Canadian patients with severe asthma, approximately 8% are on chronic oral steroids. Next slide, please. What are the problems in using oral steroids? And I've mentioned that there are adverse effects. And this slide shows you the short and long-term adverse events associated with oral steroid use. Osteoporosis and fractures, increased risk of infection, anxiety, depression, and sleep disturbance, GI bleeds and ulcers. They can also lead to high cholesterol, high blood pressure, blood clot formation, cataracts and glaucoma, type 2 diabetes, and of course, obesity. Next slide, please. So the important thing to remember, the 2 strategies for treatment, which I've mentioned up until now, namely surgery and oral steroids, do not prevent, the current treatment strategies do not prevent recurrences for nasal polyp treatment. The background treatment for these patients is saline irrigation and intranasal steroid sprays. Most nasal polyp patients will remain on these medications for a lifetime. If they become infected, they'll be treated with short-term antibiotics. Once this sort of treatment fails and patients become more symptomatic, almost all of them will go on short-term oral steroids. Up to 80% of them, if they continue to have symptoms or have severe polyps, will undergo surgery. What's the fate of these patients once they do undergo surgery? And the answer is recurrence. Polyp recurrence has been reported in 40% of patients with severe nasal polyps as early as 18 months after surgery. And the recurrence rates in the literature have been as high as 55 to 78%. Next slide, please. So these are the unmet treatment needs in nasal polyps. Obviously, the aim for us as treaters is a reduction in local swelling and inflammation. Steroid nasal sprays are first line, but they don't affect polyp size to any appreciable degree. Oral steroids are used, but when symptoms worsen, that's a problem. They get into long-term use, which is strongly discouraged due to the side effects of these medications. Surgery is considered an option when drug therapies are unsuccessful, and many patients do undergo surgery. However, surgery does not always restore sense of smell, and recurrence rate of anywhere from 20 to 50% can occur. So really, novel therapies are needed to improve long-term nasal polyp management, spare steroid use, and avoid repeated surgeries. Also, therapies that can address associated diseases such as asthma in a safe and effective way would be very advantageous in this group of patients, given the high rate of comorbidity. Next slide, please. This is a recent recommendation from the European Academy of Allergy and Clinical Immunology, who made a recommendation on oral steroids for chronic rhinosinusitis with nasal polyps. Using the highest level of evidence, they assessed the benefits-harm assessment. They concluded that the harm of oral steroids far outweigh the therapeutic benefits, which include shrinkage of the polyp and reduction of symptoms in the long term, except in patients with severe symptomatology where you don't have a choice sometimes. The recommendation is that there's a strong recommendation against the use of oral steroids for nasal polyps. They should only be used as a rescue therapy for a short-term course in patients with severe symptoms who are resistant to therapy. These guidelines are generally done using very statistically rigorous assessment of the literature, and it should be noted that Canadians sit on these panels as well. There is a Canadian guideline which is due to emerge in the next few weeks. Next slide, please. So it's on this background that I'd like to introduce Dupixent, also known as dupilumab, and these are just some fast facts. Dupixent is a monoclonal antibody that blocks the action of inflammatory proteins called IL-4 and IL-13, which are important in T2 inflammation. You'll remember that I called them growth factors, which bring the eosinophil, the cell of note in T2 inflammation, into the airways. IL-4 and IL-13 contribute to signs and symptoms of atopic dermatitis, nasal polyps, and asthma. In blocking the actions of these growth factors, Dupixent effectively treats all three conditions. It comes as a single dose, one-time use pre-filled syringe. It's administered by subcutaneous injection under the skin, under the guidance and monitoring of a specialist, and it can be self-administered. In fact, most Dupixent in Canada is self-administered at home at the present time and is approved for atopic dermatitis. Next slide, please. What do the key study findings show in the pivotal trials for Dupixent? And I'm going to show you some of the results in the trials that were done for both nasal polyps and asthma. Dupixent reduced the nasal polyp size and related symptoms. It also showed improvement in patient-reported scores. The score that's most often used in the study is something called the SNOT-22, Sinonasal Outcome Test. And this is a health-related validated tool which is used in many studies. There was improvement in the sense of smell, improvement in the CAT scans where there was less opacification noted in the sinuses. And impressively, there was a significant reduction of oral steroid use, about 74%, and significant reduction in the need for surgery, over 80%. In asthma, Dupixent has shown significant reduction in the rate of severe exacerbations or flares. There's been rapid and sustained improvement in lung function, control of asthma, and symptom relief. And Dupixent has been well tolerated compared to placebo, with the main adverse effect being local injection reactions. There's also been reduced oral steroid use in the asthmatic population as well. And given that both these diseases occur as comorbidities, certainly Dupixent has shown benefit for both these problems. Next slide, please. This is a timeline for Dupixent approval for use in Canada. It was approved for atopic dermatitis in adults in January 2018 and for adolescents in September 2019, which is where my experience with this drug comes from, seeing a large population of these people with atopic dermatitis. It was approved recently for nasal polyps in August 2020, with an expected asthma approval in November 2020. So approval for all three comorbidities expected by the end of the year. Next slide, please. I'm going to come close to the end of my presentation by showing you a slide with recommendations from the European Forum for Research, Education and Allergy, known as Euphoria. And they commented on the indications for biologic treatment according to a panel of specialists and stakeholders in chronic rhinosinusitis with nasal polyps. In those patients who had this condition and a history of surgery, they recommended that 3 of the below criteria are required before starting biologic therapy. There has to be evidence of type 2 inflammation, a need for oral steroids in the past 2 years, significant quality of life impairment, and there's a validated tool to show that, significant loss of smell, and a diagnosis of comorbid asthma. For those patients who have no surgery but are afflicted with the condition of nasal polyps, 4 of the below criteria are required. So certainly this is guidance for healthcare professionals to assess patients for the use of Dupixent in chronic rhinosinusitis with nasal polyps. Next slide, please. So these are just some of the reasons why drug plans should include Dupixent on their formularies. Nasal polyps have significant impact on health-related quality of life. Approximately 50% of patients with nasal polyps have severe asthma, which is associated with significant morbidity and mortality. Nasal polyps and asthma are caused by type 2 inflammation, which Dupixent counteracts. The current therapies, namely surgery and steroids, are associated with significant side effects and recurrences. And clinical trials with dupilumab in nasal polyps and severe asthma have shown significant benefits. So on that note, I'd like to thank you for your attention, and I would be happy to answer any questions that you may have.
Thank you for such an insightful presentation, Dr. Wasserman. So I'd now like to open up the last 10 minutes or so we have for this portion of the presentation to address some questions from our live audience. So I have a couple already for you. So my first one is, how much recovery time is required for a patient after nasal surgery?
This is obviously going to be individualized to the patients, but on speaking to my patients and those of the ENT physicians, most patients take a week off work after surgery. That would probably be the average, but depending on the patient themselves. It should also be noted that for the most part, this is done under general anesthetic and not under local.
Okay. My next one is, does surgery cure nasal polyps? And if not, how many times do you repeat the surgery?
Does it cure nasal polyps? Easy answer is no. In the vast majority of patients who have any chronic disease, nasal polyps included, there's a high rate of recurrence, and it doesn't lay the condition to rest after surgery. So no, it is not a cure. How many surgeries? I like to do as few as possible. Many patients who come to me will already have had one surgery. And if they do fail surgery or they have a recurrence or are still steroid dependent, sending them for a second surgery really doesn't give me any guarantee that they'll have a better outcome after more than one.
Okay. And which patients would you consider for treatment with Dupixent?
Yeah, there are probably 2 types of patients that I would consider. The first, as in that euphoria guideline, are patients who are significantly affected but are either not candidates for surgery, those with severe asthma, those who are older and who have, ongoing comorbidities, which make them more of a surgical risk. Those are the ones that I would clearly put on Dupixent at the onset without sending them to surgery as first-line treatment. Once somebody has come to me and they've already had surgery, if they've had recurrence, certainly in a short time frame, if they've needed oral steroids for control, if they still have significant impairment for quality of life, those patients are clearly candidates as well for Dupixent.
Okay, and is there any understanding on why Canada has a lower prevalence of polyps versus the US or Europe?
It's a good question, and it also depends on what you read. In the US, especially the southern US, there's something called allergic fungal sinusitis, which is more of an entity and prevalent in certain of the southern states. That's associated with nasal polyps and is probably the primary reason for why you see a higher prevalence in the US compared to Canada.
Okay. And who pays for the surgery versus the drug, i.e. provincial plan pays for the surgery, which is free for plan sponsors, versus the cost of drugs on their drug plan?
Okay. Look, Ontario, in fact, in most of Canada, we do have a system of Medicare where hospitalizations and any treatment associated with hospital-based treatment is picked up by the government. When it comes to medications here, if you're 65 years of age and over, the drugs of note, which are used to treat nasal polyps, namely the steroids, aspirin, those sorts of things, generally medications like antibiotics, all of these things could be covered by government as well. For other medications, such as biologics or whatever, this would have to be through private payers or again through government once negotiations are completed.
Okay. And is this considered a first line or a second line of therapy?
Dupixent, you mean?
Yeah.
Yeah. Look, I think that, intranasal steroids are first line therapy. Probably one course of oral corticosteroids would be first line therapy in some of these patients. Again, it's a question that has to be individualized to the patient. If somebody has gone through the regular route and they haven't yet had surgery, but they're considered surgical risk, high comorbidities, can't undergo that, then Dupixent takes on a more prominent role and is first-line therapy. Once somebody has failed one surgery with recurrence, Dupixent follows shortly after.
Okay. And then kind of in the same vein, are there lower cost drugs that can be used instead of Dupixent?
Certainly not in the biologic domain. There are many things which are being tested at the present time. Nothing has received approval in Canada. If they do in the next year or two, we've got to see the efficacy and safety of these drugs as well. But there's certainly nothing that gives me reassurance that when these do emerge, that they're going to be any less expensive than anything else out there. So at this point in time, these are patients who truly have a need, where no first-line therapy or what has been used as first-line therapy is effective in the long term or safe in the long term. So at this point, we do have approval and many of us are excited to get going.
Okay. And is Dupixent a biologic, and is there going to be a biosimilar available soon?
It's early days. I mean, eventually biosimilars, probably emerge for everything. Dupixent is a biologic, which means that it's raised in, a drug raised in living symptoms like plants or humans. This is a fully humanized antibody. So biosimilars are down the line and certainly not a consideration for now, but in the future, in all likelihood, yes.
And I have another one that just came in asking about, what do you think the level of comfort will be with specialists in prescribing biologics for nasal polyps?
I think there'll be a lot of comfort. For me as an allergist, we certainly have tremendous experience with biologics at the present time. We've had Xolair or omalizumab around for the past 15 years. This has been our domain for the treatment of severe asthma and hives. We've used Dupixent for atopic dermatitis. For us, moving on to nasal polyps will be very easy. We're familiar with the drug because we have used it in this condition. There's certainly a need for it based on the current treatment that we have now, which is substandard. So the level of comfort will be high. I don't foresee any problem in that regard.
And do specialists prefer a drug that targets higher up in the inflammatory pathway, or is there a preference for more targeted treatment?
Look, Dupixent is targeted as well, but it's targeted towards two cytokines that do appear higher up in the inflammatory pathway. And the benefit of that is that you're targeting multiple pathologies, namely asthma, atopic dermatitis, and nasal polyps, which all arise due to a similar pathophysiology. So in order to address those comorbidities, it's actually an advantage having something that works higher up at that stage of the game.
Okay, I'm getting so many questions. I'm going to have to narrow it down to two more. So two more,
That's
and then
fine.
you can go. Is there any evidence that Dupixent will be used to treat COPD as well as asthma?
Yeah, people are now looking at eosinophilic COPD, and that in fact appeared on one of the slides. So that will likely be looked at only because eosinophils may play a role in some of the pathophysiology of COPD. It's early days to make any recommendation of a biologic in that condition, but clearly it's a level of interest and it is being looked at.
Okay. And my last question for you is whether there are patient support programs available for Dupixent, and how have they helped your patients, if so?
Yeah. There is a patient support program, which is excellent, I might add. It's the Freedom Program. I have lots of experience with it in atopic dermatitis, and the same program is going to be handling for nasal polyps. They're extremely efficient. They contact the patient immediately. Now, especially, all teaching, since Dupixent for the most part is a home-based therapy, they are doing virtual teaching. It's been fairly effective. If the patient can't undergo virtual teaching, they'll go into the home with full PPE. If the patient wants to go to a clinic, they're available, to do that sort of on-site teaching as well. They also phone patients to give them reminders, their compliance reminders. If anybody runs out, of the drug or is about to, they make all arrangements and ensure that the supply is intact and that patients are using them the way they're supposed to. And lucky for me and every other physician, they're extremely efficient with paperwork, insurance, and any of those sorts of things that need to be done. So a good patient support program is key, and they have functioned very well, at least in the area of atopic dermatitis, and I expect the same for nasal polyps.
Wonderful. So unfortunately, that's all of the time that we have for our first round of Q&A. So I'd like to thank Dr. Wasserman once more for sharing her time with us today. Thank you, Dr. Wasserman. Continuing along, I'd now like to hand the mic over to our patient advocate, Jeff Prera. And I will have you tell your story now.
Okay, thanks, Kath. Hello, folks. I'm really excited to be here. I have a little music studio in my house, so that's what you see behind me. And there's construction going on at the place next door. So if you hear pounding and drilling, no panic. That's what that is. So first of all, I want to thank you for inviting me to share my story with you. I'll start by telling you a little bit about myself. So here goes. You know the kind of person who's really into something, they get really totally into something and get all excited, and then they won't shut up about it? Sorry to say, that's me. But I don't get excited easily. Hey, I'm a father of two. I practice meditation, so I'm usually pretty chill. So for me to get excited about something, it has to be the real deal. By now, you've all seen the data on Dupixent. Impressive, right? And all those numbers are associated with real people, ordinary people, people like me. In that data, you'll find patient number 124-002-105. That's me, the human being, the ordinary person behind that number, a guy named Jeff. So let me tell you about my experience with Dupixent and all my nasal polyps. So just brace yourself. I've had sinus issues on and off since I was in my 20s. Runny nose sometimes, sinus congestion, sudden dry cough that comes out of nowhere. My doctor said it was probably allergies. So I got tested and I got retested and it wasn't allergies. Then he got me on Flonase. That, I'm sure you're familiar with that. That Flonase helped a little bit, but then eventually it stopped helping at all. So I learned to live with it. And my friends got used to me sniffling all the time. And I got used to walking around having Kleenex at hand. So, but then my symptoms, they slowly started getting worse. I would get recurrent sinus infections. So I was on antibiotics every few months. I would get random nosebleeds. Weird. I started wheezing. My kids, they called it my whistling lung. Nice. I couldn't breathe through my nose at all. That made it hard to work, hard to sleep. I started snoring. I woke up tired, had to get the kids ready for school, and then drag myself off to work. And then I lost my sense of smell. Now, this was many, many years ago, pre-COVID. Lost my sense of smell completely, profoundly, So much so that I couldn't taste the difference between coffee and say peppermint tea. It all tasted like warm water. The scent of flowers, gone. I couldn't taste anything. All my food had the same kind of blandness. Late night snack? Great idea. What's that in the back of the fridge? Looks okay. No, not okay. It's gone bad. I had no idea. When I cooked, I had to ask my wife to check it and make sure it was edible. One time, the gas stove was on simmer and the flame blew out somehow. Gas was seeping into the kitchen. My wife rushes downstairs. There I am, sitting happily on the sofa. Hey, hi honey, everything okay? She's freaking out, opening all the windows and the doors. I'm sipping a cup of some warm colored water. So now my condition was becoming a serious hazard, not just to me, but to my family. My doctor sent me to an ENT, ear, nose, and throat specialist at a teaching hospital here in Toronto. His waiting list was more than 3 months long. So I waited, trying to keep from falling asleep at work or poisoning myself or blowing up the neighborhood. Anyway, that first hospital visit was an experience. The resident pulls out this device, like a flashlight, attached to a flexible tube more than a foot long, called a nasoendoscope. I wasn't happy about where that was going. So just try and relax, Mr. Pereira, she says. So you're going to put that whole thing up my nose. Most of it, she says, just try and relax. I say, you're going to lubricate that hose, right? Can't, she says, it'll make the lens blurry. Great. So she slides the thing up my nose. It goes up a bit and then it gets stuck. She wiggles it around and then shoves it up further, way further. It's a weird feeling, not really painful, but super weird. And then she's like, oh, jamming it around a bit more, and like, oh gosh, that's fascinating. Jamming it around some more. Then she whips the thing out, makes my eyes cross. So she hurries away and comes back with another resident. And this person does exactly the same thing. They're looking and they're really excited, like they've just discovered the Higgs boson or something. And they're like, wow, these are the nastiest nasal polyps we have ever seen. Oh, thank you. So I told the doctor about the rest of my symptoms, and he prescribed prednisone. That's a steroid. And wow, that is an amazing, amazing drug. After 3 days on that, I could breathe again, I could smell again, I could sleep again. I was cured. Well, not so fast. The doctor said I could only take prednisone for short-term relief, maybe twice a year tops, if that. And because steroids can lead to all kinds of things, diabetes, high blood pressure, osteoporosis, cataracts, mood swings. So that was not for me. So he said, well, how about sinus surgery? Okay. I thought, okay, so that means the surgeons would cut away all the polyps, cut away any bone or tissue that was restricting my breathing. I was desperate, so I said yes. I checked into the hospital. It was day surgery, but it took more than a week before I was well enough to get back to work, and nearly a month before I was back to normal. And a month after that, my symptoms started coming back. The following year, I got another sinus surgery, same result as last time. So I mentioned to my doctor that I also seem to have developed some kind of permanent lung congestion. Yeah, so he nods and says, yeah, sometimes people with nasal polyps develop a chronic post-nasal drip. This can feed infected fluid into the lungs, and that gets them sometimes permanently damaged. So he put me on more medications, all kinds: Ventolin, Flovent, Pulmicort, Symbicort, Advair. You've probably heard of all of these. And they helped a little bit. But my symptoms and my nasal polyps never got completely better. And to top it off, I had now developed full-blown asthma, uncontrolled asthma. This was the worst time of my life. I would walk down the street with my wife and say, sorry, I need a place to sit and catch my breath. I would go out with my friends and say, sorry, I'm exhausted. I need to leave early. I find myself saying sorry all the time. I'm sorry I can't be the friend you want. I'm sorry for not being the person you married. I'm sorry for not being the father you need. I started losing the things I loved, things that defined my life. My weekly hockey games, my strength was gone. My choir group, I couldn't breathe. That meant I couldn't sing. I didn't have the energy I needed to effectively run my business. My family's future was at risk. I started to skip out on social events. I gave up driving my car. I didn't know where my next breath was coming from. It got to the point where I was even afraid of walking out the front door. So I started withdrawing from the world. I started disappearing from my own life. And then it got worse. My fear about not being able to catch my breath blew into full-blown panic attacks. Maybe you know how terrifying those can be. I hope you don't. One time I was in my car with my wife and 2 children and started to panic because I couldn't breathe. They turned the car around and rushed me to the hospital. You know, some of us here are parents. As a parent, this is my thought as a parent, our number one job is to nurture and protect our children. When I was laid up in a hospital bed, connected to a bunch of machines, my children were there. Let me say this. It's terrifying for a young child to see their father in a hospital bed. I saw the fear in my children's faces. I saw it in my wife's face. We've been together more than 35 years, but we had never been through anything like this. I had to do something. I had to find some kind of solution, but there weren't a lot of options after that. And my family doctor referred me to Dr. Ken Chapman's clinic at Toronto Western Hospital. And he told me about the Dupixent clinical trial. My symptoms were getting worse. My medications had stopped working. I was in big, big trouble. So I said, okay, all right, let's do this. I was ready to try anything. I just hoped and I prayed that I wouldn't be stuck in the placebo group. So I started on the trial. 1 week in, no difference. 2 weeks, and I knew something good was going on. I was definitely not in the placebo group. I felt like I was starting to get better. Was this really happening? Yes, it was. After decades, many decades of suffering, something amazing was happening. My body was starting to heal. After a few more weeks, there was no more wheezing, no more shortness of breath. I had energy again. I went to see my ENT one more time. This time he did the scope and projected the image on the big screen in the office. He gathered the residents all around. He said, come here, look at this. This is what a healthy sinus is supposed to look like. Wow, what a change. I told him about Dupixent, how it had fixed my nasal polyps and my asthma. And get this, I have had 0 colds or flus since I started this drug. Before Dupixent, I used to get those all the time. I'll let that sink in for a moment. I have or had severe symptoms, seemingly untreatable, and now they were gone completely. I realized how much my illness had taken away from me. I realized how it had prevented me from being the person I wanted to be. Since I started Dupixent, I feel like I'm back to being strong, reliable, energetic, hardworking for my family, for my company, which does virtual reality and augmented reality, for my beloved friends on my hockey team, where I play hard against guys 30 years younger than me, my fantastic choir, where I sing first tenor. All these things were lost to me and now found because of this great medicine. I had 2 surgeries that didn't work as well as Dupixent did. If I had been on Dupixent sooner, I could have avoided all the surgeries, all the steroids, all the antibiotics, all the inhalers, all the hospital visits. Maybe I could have even avoided the full-blown asthma and the damage that has caused to my physical and mental health. Many of your clients, your stakeholders, maybe some people you care about, certainly have nasal polyps and don't know what to do about it. Maybe they won't speak out. So let me speak out for them now. Over the next few years, you will certainly be hearing from thousands of people about how Dupixent has helped them. I'm so lucky and so happy to be one of the first success stories. Thank you.
Wow, thank you so much for sharing your story, Jeff. That was really impactful and I really appreciate it. I'd now like to open up the remaining time we have to address another round of questions from our live audience. And I already have a couple on hand for you. So the first one is, how long have you been living with nasal polyps?
Well, my symptoms, they started when I was in my early 20s. And, it just started with the runny nose and stuff like that. And it slowly developed. And now I realized that was the beginning stages of this inflammation. And that really got worse, and eventually where I developed, small polyps, which weren't really noticeable, but they just got bigger and bigger. And eventually the membranes inside my sinuses were getting destroyed by this inflammation.
Wow. And what was the surgery and what was the recovery like from that?
The surgery, it seems really straightforward, because what they do is they insert something into your nose. It's got a light, it's got a bunch of blades, it's got a bunch of other stuff, and they cut everything out from inside. They cut all the polyps out. They cut off any kind of bone that may be sticking out into this air that may block the air, any kind of tissue which is thickening and stuff. And the surgery, really, you go in, it's day surgery. It goes pretty quick, but once you get out, the recovery time, it took me almost a week, actually more than a week, before I was able to go back to work. Because what it's like, when you're outside and it's super cold outside and you take a breath and you can feel it's like that, except now imagine that you have a raw wound inside your nose and you can't breathe cold air, because it's really, really painful. So, it hurts. It hurts a lot, and it takes a while. And then I think it was, for me, probably a month before I was back to normal. So the surgery is simple, but the recovery time, it can be a bit rough.
Okay. And the next one is, how has Dupixent improved or helped your quality of life?
Well, it's pretty good. It's a pretty good drug. I mean, I talked about it a little bit there. How has it improved my quality of life? You know what, Cass, it's crazy. I don't even know where to start. Like, you heard what I said. Like, before, I was literally housebound. I was at a point where I dared not go outside, because if I had an asthma attack or something like that, I'd be in big trouble. And I started developing panic attacks. I stopped seeing my friends. I stopped doing all the things that I really loved to do. So, like, I can't like, it was terrible. And these things, I have my wife is terrific, and she kind of took care of me. She was very patient, but it was hard on her too. It was hard on my friends. Like, they'd say, okay, let's go do something. And I'm like, no, thank you. They say, well, should we come over? It's like, no, don't come over, because I don't have the energy. And, and it became depressed. It's depressing. And how has it changed my life? Well, I mean, I've been a busy guy. I've done a lot of stuff. I've run a bunch of companies. I play hockey. I play tennis. I sing in choirs. I write music. I do all kinds of stuff. And now I have to give all that stuff up. And now I can do that stuff again. It's been transformative. And weird. I just thought of this at the last minute, but I have not had any colds or flus since I started this drug. So, and before that, I used to get them all the time. Like several times a year, I'd have flu symptoms and things like that. But I haven't had any of those. And especially in this environment, that's a big comfort. And I've been great. So,
right.
Yeah.
Okay. And just kind of one area that I wanted to focus on, maybe just for our audience here today, like, how has this impacted your ability to work and attend, go to the office? And, well, not now because of COVID, but when this first started, just how did it impact your work life before and post Dupixent?
Well, you know what, Cass, what happens is that I had trouble breathing. Like, I'd have, sinus congestion and stuff. Okay, I can live with that. But I had trouble breathing, and I would get tired really, really easily. Like, I would be at my desk, but I know I'm just not being really efficient, And then I go home, I'm tired, and I sleep, and I can't sleep because I can't breathe properly, and I wake up tired. And it just builds one thing on top of the other. And, I get tired, I get irritable, and things became difficult all around. And so, yeah, it really affected my ability to work. And I mean, not in a way that anybody said, like, dude, go home or anything like that. But it was, I was aware that I was not getting done in my workday, getting stuff done that I wanted to get done, and like, since I started, I mean, since I got on Dupixent, Like it was great. Like I'm back. I sleep, I sleep well. I have lots of energy, so yeah, it's like I feel like I'm kind of going on and on about it, but it's worked great for me.
Good to hear it.
Yeah.
Good. I've got two more questions for you. One is, was the transition from clinical trial drug to commercial seamless, or did it require a lot of paperwork?
I have a great team of people that have been that I've really had the pleasure to work with. I've worked with the people who ran the clinical trial. First of all, Dr. Ken Chapman's office. He is terrific doctor, and they made it super easy. And then they connected up with the people at Regeneron, the people at Sanofi. And I'm sorry if I missed anybody else, but really I didn't have to do anything. I just said, look, this is, I want to, this is what I need to happen, and it just happens. And I get deliveries of the medication in a cooler once every couple of months or something like that. I get a delivery and I pop them in the fridge. So it's been really, really fantastic.
Wonderful. And the last question I have for you is about any side effects. Do you have any side effects with the medication that you're on?
No, nothing. It's weird. The hardest thing for me was as part of the clinical trial, they don't have one of those self-injectors. So I have to literally get a syringe and stuff. That freaked me out, because it's that's not just something I was really used to. I mean, it's really easy. Just use a bit of alcohol, you stick it in. But the fact that I was kind of sticking a needle into me, it felt weird. But in terms of side effects, in terms of bad side effects, no, absolutely, it's weird, right? Because a lot of medications you feel a bit of this or you feel a bit of that you kind of willing to put up with. This is nothing, absolutely nothing.
Wow, fantastic.
Yeah.
And I actually got another one while we were speaking about the longevity. Will you be on Dupixent for the rest of your life?
I would have to double check that with my doctor. He has told me that some people on the drug, they are actually cured and they don't have to be on Dupixent anymore. And some people are not. Now, I don't know where I am because I haven't been off it. I've been on it continuously for several years. So Cass, I really don't know. I expect that I'm going to be on it for the rest of my life. But if my doctor says, hey, do you want to try going off it for a couple of months? I would try that, because I know if things go bad again, I can go back on it. And, I know that there are some drugs you take them for a while and then they become less effective. But it's been working great for me over this, now several years.
Wow. All the other questions I have already been addressed. So I guess, do you have any last remarks that you want to make, or anything that wasn't said that you'd like to say before we end today's webinar?
Well, yeah, I guess, I know biologics, they're expensive. They can be expensive. But I was just thinking, about how much money the healthcare system has spent on me. Because of my nasal polyps, because of my asthma, I've had 2 surgeries. I've been in the hospital several times, antibiotics, steroids, doctor's visits, all that stuff, And the crazy thing is, I know that Dupixent isn't necessarily the first thing that people will try for this, but in my case, if I had gotten it, I know it wasn't around several years ago, but if it was available when I started, my life would have been so much different. All this, I went through a lot of suffering, not just physical suffering, but a lot of mental suffering, like anxiety and things like that. My family went through a lot of suffering and things like that. And, you think, what's that worth? You measure the value of that in terms of relieving people's, the kind of suffering that people have to go through. I mean, that's worth a lot. That's worth a lot to me.
Right. We actually did just get another one in. We've got time for one last question. So you did, during your presentation, you talked about, fear with exercise. Have you gone back to being able to, do strenuous activity without that overwhelming fear?
Cass, I go hard since now. It's been like after the Dupixent, even after like maybe after the first month or so, I was able to go back. So I play ball hockey. Ball hockey is one of those games where you have to run all the time. And I play against guys who are 30 years younger than me, and I go hard against them. So I was in a tennis tournament on the weekend, so I swim. Yeah, I go full out. For an old guy, I do pretty well.
Amazing. Great. And we can do one more and then we have to stop. But wow, sure. People really want to ask you questions today. Do you worry about changing jobs at all and different coverage between employers and whether one covers Dupixent versus not covering Dupixent? How does that affect you?
Well, you know what? I can't really answer that because I've been running my own company since I was in my 20s. So I've run a bunch of companies. So I've always basically been the boss. I had a bunch of TV production companies. I've made a living as a writer, and right now I do virtual reality, augmented reality for human rights. So I can't really answer that. I'm not really qualified to answer that question because my jobs, I always had the same job.
So I guess a more appropriate question would be, what would your advice be to a plan sponsor who currently doesn't cover this on their plan? Or thinking about covering it.
Yeah, well, you know what? That's not a really simple thing because medications are expensive, and you have to make sure you get the right medication to the right person in the right way, and in the most cost-effective way. Mm-hmm. So my guidance is, I think people should be able to get Dupixent because Dupixent will get you. If you need people to be treated and healed, it will get you there without having to go through all the preliminary steps where you're going to spend tens, hundreds of thousands of dollars, trying stuff. And at the same time, people are going to be taking time off work. They're going to be unhappy at home and coming to work and being cranky at home, So you know what? I'm the wrong guy to ask because it's been so great for me. So I'm saying, yeah, of course, put it on the list. Get it out to the people who need it.
Right. Okay. So unfortunately, that is all the time that we have for questions. So thank you for your questions and your informative discussion, everyone. I'd like to thank our speakers, Dr. Susan Wasserman and Jeff Prera, once more for sharing their afternoons with us today. And I'd also like to thank our sponsor, Sanofi Genzyme, for their support and hard work leading up to today's digital event. And thank you to everyone for tuning in. When you exit today's webinar, you'll be prompted to answer a survey, and we'd appreciate if you took the time to fill this out and provide your honest feedback, as these results are integral to the planning of our future webcasts. Have a lovely afternoon, everyone. Stay safe and look after yourselves and loved ones.